Be your nurse today. I have assessed the room. There's nothing a patient can trip over, nothing hazardous. I have closed the door for privacy. I've provided hand hygiene. And what is your name and date of birth?
And 28.99.
Okay, can I see your wristband, please? Okay, thank you. 10. Okay, perfect. Okay, Hannah. So what are you in for today?
Sinus pressure.
Sinus pressure. When was the onset of your sinus pressure?
About 2 weeks ago.
2 weeks. And where is it located?
Just here in my sinuses and in my nose as well.
Is it come and go for the duration, or have you had it the whole duration of your?
It's been pretty constant.
Pretty constant. Okay. What are the characteristics of your pain that you're feeling?
Just pressure in the sinuses, and then sometimes like a sharp, dry, almost feeling in the nose.
Your nose. Okay, like a hollow, dry. Okay. And then do you have any associated factors, like eyes watering or a sore throat?
I've always had a pretty bad post-nasal drip from allergies.
Okay. Have you tried any remedies for your?
No, I take Claritin.
Okay. How many times a day do you take your Claritin?
Just the once that it says to.
Do you know the dosage?
Not like milligrams or anything. It just says take 1 pill a day.
Okay. And then have you ever sought treatment for this before? No. Okay. So I'm just gonna ask you some other interview questions. Do you have any allergies?
Yeah, environmental and like animals and stuff, but not to medications or anything.
Okay, and that's over-the-counter prescription allergies. Do you have any latex allergies? No. Okay. And then what is your medical history? Any other things I should know about?
I've been diagnosed with asthma, and I've had 2 knee surgeries. Fasciitis.
Okay, and with the knee surgeries, was those hospitalizations?
In and out patient.
In and out, okay.
Or outpatient.
Oh, okay. Are you currently taking medications?
Just birth control.
Birth control? Do you take any over-the-counter, like a vitamin or anything like that? No, okay. Are you up to date on your immunizations?
Probably not.
Probably not? Okay. Have you seen a doctor earlier this year?
No. I just get, as of me going to college like 2 years ago, I've been up to date because you have to. But since then, like when you should get like the flu shot and stuff again, I haven't.
Okay. Okay, sounds good. And then I'm going to ask you a question we ask this to everybody. Have you ever smoked before? Have you ever drank before?
Yeah, I'm an occasional drinker, like not even every week, like maybe like 4 times a month.
Okay, in those 4 times, how many drinks do you drink in your setting?
I don't know, like 1 or 2 glasses of only wine.
Okay, you say about 8 ounces or so. Yeah. Okay. Have you ever done any drugs? No. And then you feel safe in your home environment, community. Okay. And then that finishes our interview portion of the exam. I'm just going to read it out. Thank you. I'm going to uncross your feet for me. It's okay, I always do it too.
I know, I'm pretty good about it because I normally cross my whole leg.
Okay, so we're going to do a 2-step blood pressure. I'm just going to find our readings first. This is also done at 1:15, so I know to pump it up about 20 minutes further than that, so I don't have to pump it up unnecessarily. And then I'm going to take your pulse while your arm relaxes. Your radial pulse. Thank you. Her heart rate was 64 and her respirations were 16. I would also take her temperature with a thermometer, but I do not have one right now. And I guess it would go under her tongue. Okay, now we're going to do your second blood pressure. Okay, your blood pressure is 118/70. Is that normal?
Yeah.
Okay, perfect. Okay, now we're going to move forward with the exam. Okay, I'm just going to kind of start at your head and work downwards. Okay, looking at her head and going through her hair, I noticed no lumps or lesions of any kind. Her hair is not excessively oily or excessively dry. Her hair is shiny and malleable, so it's overall very healthy. And there's also no infestations of any kind. Just kind of feeling her head. Her head is symmetrical, it's round, there's no indents or deviations of any kind. It is symmetric. Looking at her face as well, her face is also symmetric. There's no deviations of any kind. Her jawline is fine. And then assessing her ears, I'm just feeling her ears are an even temperature. They're not overly hot. They are not red or inflamed or irritated. She does have a new piercing because it is slightly red and there's a little bit of drainage in there. Is that one new?
Mm-hmm.
Yeah, okay. And then no drainage coming from either one of her ears as well. And then assessing her auditory nerve. What do you hear?
Like rubbing.
Rubbing. Or do you hear equally on both sides?
Mm-hmm.
Okay. The auditory nerve is intact there. And then I'm going to do your nerve 5, your cranial nerve 5. I'm just going to place my hand on your face and you can just tell me where you feel it. And close your eyes.
Close my eyes.
Yes. Perfect. And you open your eyes and just clench your jaw for me. Perfect. Her jaw clench is very symmetrical, feels fine. Okay, and then what I'm going to do, I'm going to do your facial nerve. So you just want to raise your eyebrows, scowl.
Angry.
You want to close your eyes really tightly, open them, and smile, frown, and puff out the cheeks. Cool, perfect. That looks fine. And then, so her facial nerve is intact with all these motor movements. When I look at her eyes, they are equal, they're round, and they're almond shaped. Her eyelashes are going outward, no intropin or exotropin noted. There's no crusting, no stars are noticed. Her eyes are white. Can you pull down your eyelids for me? Perfect. Her cornea look fine, or her conjunctiva look fine. Excuse me. They're just the natural red color. There's no edema. There's no blue. Like I said, no crusties, no styes noted in that. There's no drooping of any kind. And then with her nose, I'm just pressing maxillary sinuses, your frontal sinuses. You feel a little bit of pressure, like you said. Okay. No pain up here. Okay. I'm looking at her nose. There's no deviation noted. Her nostrils are symmetrical. And I'm just going to shine the light up in your nose real quick. Is that perfect? Yeah, no deviation noted. Both sinuses appear clear and open. And then just looking at her lips right away, they are a natural pink color. They're moist. There's no cracking, no scaling of any type. Okay, what I'm going to do is I'm going to feel your lymph nodes really fast while I'm up here. I do not feel any enlarged lymph nodes at all up your nose. And we're going to move with her eyes first here. With the oculomotor nerve, we're just going to do that. And looking at her eyes, her pupils are in the center of her irises. They are both round and symmetrical on both sides. I'm going to shine a light real quick just in your eyes. Perfect. Her pupils are reactive to light. They do constrict when light is emitted into her eyes. Okay, I'm going to have my finger here. If you can look right past my finger and back to my finger for me. Perfect. She is accommodating her eyes. They're dilating for the further distance and constricting back to where my finger is. And then we're going to do, just watch my finger when it goes into figure 8 motion. This is going to do the abducens, the triclear, and the oculomotor nerve. There we go. Perfect. And those nerves are all intact there. And then what we're going to do as well is I'm going to have you open your mouth for me. Okay, her oral mucosa is pink and moist. There's no lesions, no abnormal colors and whatsoever. She does have all of her teeth. They are white. There's no chipping, no lost teeth of anything like that color. Perfect. And looking at the back of her throat, her nasal is a proportionate size. It's in the same place. Her tonsils I would rate as a 1+. And then can you say "ah" for me? Perfect. Okay, you want to stick your tongue out. Can you go up and down with it, side to side? Perfect. The hypoglossal nerve, nerve 12, is intact with that. Her tongue looked pink, normal. No excessive lightness on the tongue whatsoever. By her being able to say "ah," her vagus nerve is intact. Can you swallow for me? Perfect. Her gastroesophageal nerve is intact as well, being with her case of abling to swallow. And then let me just feel your skin here. Even temperature. There's no lumps or lesions of any kind. There's no scarring in any of her tattoos. No redness under her tattoos either for any rashes that I can see. Just going to go your back here. I'm feeling her back. It is a little bit warmer than her arms, but that's understandable. There's no other lumps and lesions. Her skin color is true to her ethnicity. Looking at her hands, new skin turgor on her hands, pinch and let go. It rebounds perfectly to her skin, which is just fine. Her nails seem attached to their nail bed, no clubbing, no color. Her capillary refill is less than 3 seconds, which is within normal range as well.
They do that test on horses.
Yes, they do. Okay, so with that, we're also going to do your nerve 12 as well as your lower extremities. And before I get to your lower extremities, what I'm going to do is I'm going to do your spinal accessory nerve. Just rotate your head to the right, rotate your head to the left, and then shrug up with your shoulders. Perfect, that nerve is intact there. Okay, what I'm going to do is, this will be a sharp pain.
Okay.
This will be a dull pain.
Okay.
Are you able to distinguish between the two?
Yeah.
Okay, so I'm just going to go randomly with your eyes closed on your arms and legs, and you just tell me which one it is.
Sure. Go. You're good.
Okay. So nerve 12 is intact as well. With the child reflex nerve here. Okay, we've got a little reactivity here. And these surgeries may be a factor.
Yeah, I have tinnitus too, so I don't know if that.
So she did react to them. So that nerve is intact with everything there. Okay, so I'm gonna have you stand up for me. And first, we're just gonna have you close your eyes. We're gonna do a Romberg test. So you just stand still. I have my arms out for you. Okay, perfect. You guys, Romberg test is negative. There's super slight swaying, but that's very normal. And then I'm also gonna have you walk across the room and come back normally. Her gait looks normal. There's no balance issues. She's walking evenly and symmetrically. Normal arm swing. Okay, so I'm gonna have you turn and face this wall and just flex your back downwards for me. Okay, perfect. I'm assessing her spine. There's no scoliosis or anything like that. Her spine is perfectly normal. Okay, and then you just rotate your spine for me gently. And then we're gonna just go to both sides. Perfect. Her spine's range of motion is just fine. I'm moving to shoulders. We're going to extend the shoulders and flex back down. And then we're going to abduct outwards and come back down. Abduct, I'm going to cross your arms in front. And then we're going to externally rotate backwards. Then we're going to extend and flex out. Perfect. And then we're going to assess your strength. So just push up for me. Biceps are a +5. Push down. Triceps are a +5 going that way. Hands are supination, pronation, back and forth. And then can you do your thumbs to your fingers? Her rapid movement is just fine. And then you do adduct and abduction of fingers. Do flexation, extension of fingers. Opposable thumbs. Do rotate your wrist inwards, outwards. Rotate. Perfect. Okay, and now we're going to do, you're going to put your arms out. I'm just going to reach and touch your nose, each one, and then do it with your eyes closed. Nose to nose. Okay, your mouth was closed. There you go. Cover yourself. Okay, so we're going to do extension of your leg and flexing it back. Extensions of your leg, flexing it back. Do your back. Oh, not going to go overhead like that and come back. And come back. We're going to come up with your knee. We're going to do external rotation and inward rotation of your knee. Perfect. Extension, inward rotation.
Balance sucks.
And then we're going to come back. Flexation this way. This way. Perfect. And we're going to do abduction coming out and adduction coming back. Other side. Perfect. Okay, so now I'm going to have you sit down. And we're going to do some strength and flexation and extension of your feet. Perfect. Okay, so can you lift up each leg or both at the same time? Okay, perfect. That's a 5+. Then do dorsal flexion, bring your feet upwards. Then bring it up again. 5 for strength there. Do plantar flexion again, perfect. And plantar flexion. Wait, perfect. 5, everything is fine there as well. And then you want to do internal rotation with your feet, external rotation of your feet. Do a circle for me if you can. Perfect.
I was like pigeon toe and whatever that is.
Okay. And based on all her reactions today, with her being able to say aw, her vagus nerve was intact, if I forgot to say that earlier. And then she is alert and oriented. She is dressed appropriately. Her hygiene is clean. There's no hoarseness in her voice at all. Other than that, you have done great.